Good evening. I'd like to call the regular meeting of the Eureka Springs Hospital Commission to order at 6:01. You all received copies of the minutes. I would entertain a motion to approve the minutes.
So moved.
Do I have a second?
Second.
Any discussion? Hearing none. All in favor say aye.
Aye.
Any opposed? Motion carries. Next item, I would like to submit the agenda for this meeting, March 20th, 2023, and ask if there are any changes or additions. Do I have a motion to approve?
So moved.
Second?
Second.
Any further discussion? All in favor say aye.
Aye.
I don't think we have any public comments tonight. Committee reports. Mine's going to be very short. The finance group has been meeting and discussing, and we have decided that it is time for us to move the accounting finance in-house. Not that Bill, who's on the phone with us, Bill Couch is on the phone. And I forgot something. I need a roll call. Hold that thought. Go ahead.
Sharon Doremus, Commission.
Judy Gigi, Treasurer. No, I'm
Dave
not
Carlisle.
the Treasurer. Secretary.
Commissioner.
Whatever I am.
Kate Dreyer, Commissioner.
Angie Shaw, CEO.
My apologies. Kent Turner, Chairman. And going back to what I was saying, it's not that Bill hasn't done a tremendous job for us, but as we move into what we hope is going to be the project of our life, it is going to be essential that we have people on the ground to manage that project from an accounting standpoint. And we have, Bill's going to be with us for a period of time, but we're going to start looking for additional accounting help. And then we'll put, hopefully be able to find and put in place an on-site CFO. Hospital expansion report. Mike's not here, so I will give you a quick rundown. We completed last week on March the 14th, I believe was the date, the 35% design. So we are in a position now of where we can present in detail to planning, to HDC, to the City Council, and to financiers a vision of what the hospital, it's more than a vision. It is actually a very detailed description of what the hospital renovation will in fact look like. It goes down to rooms and sizes and departments. The staff has done a tremendous job, and our consultants have also done a tremendous job considering the time crunch that I have put them under. It is quite impressive, and we're going to probably all sit down and take a look at it at the April 1st Saturday workshop. Just because that's the time that we can actually talk about it and put it up on the big screen down at Main Stage and look at the different possibilities. With regard to the financing, I have requested a meeting with the governor. That has not been confirmed yet, but as soon as that gets confirmed, I'm going to go to Little Rock and have a meeting with the governor to discuss the potential for getting ARPA funds for the hospital. That is in addition to the work that we're continuing to do with the federal government on getting funding from the federal government. But that kind of in a nutshell is where we stand as of today.
Pardon me, Ken, what's ARPA? What, Arkansas?
You would ask me that, wouldn't you?
Arkansas Rural.
Oh,
It's-
rural, that's what.
It's COVID money is what it is.
Okay.
Arkansas Rural.
American Rescue Plan. We're all wrong.
Yes.
There you go.
American Rescue
Oh,
Plan.
yeah.
American Rescue.
Act.
Okay.
Yeah, maybe. Yeah. Very good.
But that, that's, the state of Arkansas is fortunate that they have some funding left over, and I'm hoping that we can convince them that we deserve some of that funding. And I look forward to the possibility of being able to do that. Angie, CEO report?
Yes, I did hand out a copy of my report along with Sam's marketing report attached. Since our last meeting, we've seen 5 positive COVID cases. We're actually seeing more upper respiratory illnesses, especially over these past few weeks, as well as strep and other viral illnesses, but a lot less COVID. In our clinical services, we are still looking for a full-time pharmacist. We did hire a part-time pharmacist. Tammy started in March. First, nothing I'm worried about at this point. And then also, Dr. House has transitioned into the role of our hospitalist, and he's doing a great job there. In the ER, we are seeing an increase in emergency room patients so far for the first quarter. Both January and February have surpassed previous years, and March is currently trending to do the same. The ER is scheduled to have a trauma redesignation review this Thursday, and Joy, the ER director, is focused on getting that ready. Our representatives from digital healthcare software platforms, as to date, there's only one that is all-inclusive that offers a focused program for our critical access hospital.
Is that basically, does that contain an EHR? And
Yeah.
whatever else it takes to?
Yes.
to find-
We have searched out several, and none really pertain to critical access. We've questioned. On the marketing report, just a couple of things on there is Sam has worked diligently on this, and our new website is live. So go in, take a look. It looks great. Everything is.
Bill, you're on with the CFO report.
Okay. First thing I want to report is that in the month of January, the payment made to the architect was expensed. It should have been placed into construction in progress. So we moved that out of expense into construction in progress in February, and that was $106,562. And I'll point that out to you here in a minute. The next page has to do with our cash position, and we had the over $3 million increase in our cash holdings. That was due to the receipt of the sale of the Home Health Agency. First column on the left-hand side of the page, a credit for purchased services, and that has to do with us moving that construction in progress that was actually expensed last month. So that's why that is showing as a negative. Total operating expense, we're averaging $743,000 per month year to date, and that is slightly less than last year. It was $756,000 last year. Our operating margin is down $300,000 for the year, and that indicates with the lower patient load that we've carried the first 2 months working into the month of March, is that Medicare and Medicaid actually owe us money probably from those 2 months of operations. I want to point out equipment, the construction in progress or process as it's called there, $379,000. That's an increase of $354,000 over the prior month, and that's the movement of the $106,000 plus the $248,000 we paid in February. So that's basically all I have, Kent.
Have any questions of Bill?
I do.
Okay.
Do we have to pay any taxes on the sale of that?
We are,
home health?
we are classified as a government entity, so consequently, we're not a nonprofit. We are classified as government because we are part of the city, so the answer is no. That's correct, right, Bill?
Yes, sir. And even if we were a nonprofit, we would still have no other business income tax related to that, because that is a healthcare related, it's part of our purpose.
Early from the physical building standpoint, but from the detail that's in each one of the departments, size and placement and things like that, you'll see just exactly how much time that they've spent on it. I very much appreciate that. I also appreciate the fact that our consultants have worked as hard as they can. They would not have normally been able to do this, or would not have done this in the short amount of time that they've done this in. And they've just done a really excellent job of doing that. The final thing I'd like to say is, from the standpoint of the community, I know just by what I've heard from people that everybody knows the need for the hospital. But we're going to need a lot of community support moving forward with this. And I would ask the community to make sure that they give us that support